So it's Monday morning. We have a patient we haven't seen in a really long time. They had an older tie base restoration, and with all tie bases, eventually the cement breaks and the restoration breaks. So let's see what the damage is and what we have to do to fix it. Welcome back. How you doing? All right. Okay, that looks good. So what's going on? Restoration's funny.
Bigger crack, and then the bottom is loose, but a bigger crack from here this way.
Okay.
And this side is not looser than this side.
All right, let's take a look. So the last time I saw you, almost 5 years ago. You don't like me that much? All right, let's see what we could do to address this, okay? Have you been going to the dentist or not even?
No.
No, okay, cool. All right, let's see. This is also, the bottom is also loose here.
Mm-hmm.
The whole thing is loose. This is Medenti base. I think they're biaxial heads though. Surgical. Clean it. Okay, cool. So let's go over what happened, and then we go from there, okay? We can make a decision together what we want to do. So this is today's x-ray. You essentially have not lost any bone over the past 5 years, which is excellent. So your implants are under control. The problem is that what happens is that over time, your bite changes. As your bite changes, you start to create forces on your implant screws that are not balanced, and then you start to overload some pieces. So what happens is the first thing that gets loose is usually the screw that's holding the restoration in. When the screw is loose, it's sort of like a tile that's like not leveled. And then what happens is that you have the top one which is not moving, and then you bite down and it just explodes. So you broke it right along here. So that means now that you have two pieces. You have a piece here and you have a piece here. It's not the end of the world. But on top of that, the piece that holds this restoration in, which is what's called a titanium base, actually fell off of the restoration. So now that you have two pieces, you're more likely for this to happen again and happen even worse and have more problems. You have one of two choices of what you can do. Option number one is I can put everything sort of like back together. It's still gonna be two pieces, and it's very likely that it's gonna happen again. It may happen in a month, it may happen in a week, it may happen in a year. I don't know, it may happen again. The alternative is that I already designed the restoration that's printing now, which is basically the way that we make it now, which has a big titanium bar on the inside. You saw that, yeah. And then I put the whole pieces together. So my recommendation is that you have it redone the right way. It's not crazy money. It's just in order to pay for whatever the parts cost. And that's really it. Okay, so we decided we're gonna upgrade the case to be with a power bar and a titanium power bar and a zirconia overlay. The beauty of all of this at the end of the day was that we had everything done digitally and we still had all the files saved. So all we had to do is just convert everything to power bar, printed the restoration in under 12 minutes, put it in, and boom, the patient's ready to go, and Thursday he's gonna have his restoration. That's the beautiful thing about digital dentistry. It's just like, wow, so easy to do for the patient, and hard for us, but easy for the patient to just do what they have to do. That's it. Super, super special morning. This man, I am so proud of him. He drives 3.5 hours to come here. He is legally blind. He is a hard-working American, and today, we're finally gonna give him the smile he's been dreaming out his whole life. Follow this story. It's gonna blow your mind. Okay, here we go. What's up? You remember yourself? Close. Take a look here.
Oh man.
Remember that?
Yeah, holy smokes.
That. Today, wowzers. Here we go. All right, we're just gonna pop these out, put the new ones in. Looking good. Here we go, all right? Let's do it. And just bite down. All right, open wide. Suction. All right, top is done. About to do the bottom. You've been showing them to everyone?
Yeah, I work every day, so everybody at the store.
Ah, they be checking you out.
Yeah.
All right. Woo! Damn! Okay, ready to see yourself? Nice shoes.
Thank you.
All right, come ahead and take a quick look. What you think?
Much better. These are nice.
Woo! You look good, man. Just smile big. Big smile, big smile, big smile. All right, I got you. So turn around. Take a look.
Nice.
And he's gonna learn to smile. Wow, you look so good.
Thank you, man.
I'm proud of you. Come, have a seat. We're gonna close up those little holes so you don't get no food stuck in there.
Oh, great.
And then you are. Hello. Open.
Okay.
I didn't forget about the Woodstock.
Oh. Because it has to dual cure because it's zirconia. I may not get the light to go through it for sure. You okay? No, that's nothing. A retractor. Don't worry, it's just pressure. Doesn't get better than that. Screwdriver. Okay. I'll come back and cement it, okay? Looks amazing. Just stay open, okay? We're gonna cement everything now. That's a hard case. We're gonna prepare the teeth. He had a failing implant, like completely in left field. I thought it was like Hail Mary. He wasn't gonna have an implant that was there, but we're able to regraft with a laminar bone plate and some ogma bone and some particulate bone and soft tissue graft. And it's got a low smile line, but still came out really good. Zirconia veneers. We finished it all in-house, and I'll show you the before and after in a second. Let's do it. Right, yes. Could I just have a thing of alcohol? There's some of the polishing paste still left on it. Good, open. Bite again. Okay, open. Bite gently. Activate. Bite. Good, open. Bite.
Yeah.
All right, let me set you up so you can see what you look like.
Good.
Crazy, right?
Yeah.
Lift up your... You look awesome.
Looks
Look.
great.
Yeah.
So much better.
Crazy, look, compared to where we
So
were.
much better. What we had before?
I mean,
know.
like-
I know. You're not telling me. I wish we did it before the wedding. I know. I should
all
have
right.
done it before.
You have the rest of your life now.
Oh, yeah.
Thanks.
All right.
I'll see you again in 3 months.
Okay.
Okay, schedule in for 3 months from now. this. Suction. You can take a look. Look at this. You can see it's got a big metal bar on the inside, so you don't ever break it again. And bite. Perfect. Open. Damn. That looks good. Have a mirror. She'll close it up. We'll scan you, and then you could come by sometime next week. I'll have it ready for you, okay? You make them so all I need you to do is we'll take the x-ray, close the hole, scan him upper and lower, and then make him a temporary guard. And that's it, and he's all set. Thanks, boss. You did amazing, okay?
Yeah.
Thank you. All right, let's see where Gary is. Oh, you're good. Be super easy. You'll see. You'll see that implants are actually quite simple. The hard parts are always teeth. Teeth are the ones that cause the most problems. So for the teeth, I gotta make sure you're really numb so you don't feel anything at all, okay? All right, so I'm gonna give you a little bit more in the wisdom tooth one, all the way in the back, okay? All right. So we're gonna send in amoxicillin. You should be. Okay, I'm gonna give you the pain medication today, right now, and the antibiotics. So you don't have to worry about after the surgery running to the pharmacy. You could pick it up tomorrow morning and start that tomorrow, okay? Okay, I'm also gonna give you the Advil now so that it prevents any pain from happening. When you get home in about 8 hours, you could take the second dose. 10, yeah, lunk. You have very little bone there, so we're gonna have to do some fun procedures for you. The reason that you have so many problems in that area is because sometimes you have too many teeth for your mouth. And then what happens is that you don't have the ability to clean it. And that's why you've spent so much money in that area of your mouth. Well, you see you have, I guess your insurance did, because I know you told me you didn't pay for it, but you've had a root canal, you paid with your time. You've sat down, you've had a root canal, and you've had a post, you've had a buildup, then you've had a crown. All of that, why? Because you keep getting a cavity there. Problem is, like I told you, most dentists, they just fix the problem, right? They don't say, why did the problem happen? The reason you're having this problem is because the teeth are all the way in the back of your mouth. Like you see, even when I got you numb, I had a hard time getting the needle back there because it's all the way in the back. And if it's all the way in the back, the food gets stuck there. And even if you brush your teeth, it doesn't go away. And it just eats away at your teeth. That's why those teeth, those two back ones, you don't need them. It's the one that has a hole, but this one also I don't make it down on the inside. In between the root I had a hole. That's why you see all the blood on the inside. All right, so you got to see a small glimpse of what happens in a dental practice, and most importantly, a full arch implant practice. And you know, you never know what's gonna come in, how it's gonna come in, and more importantly, how you're gonna solve that problem. You know, you saw some cases where we had an old case that fractured, we had to fix it, but we had to fix it really easily. The patient came in on Monday, we finished the case on Thursday. We didn't have any problems with the patient, we were able to do that. And the beautiful thing about having a digital practice is all the patient's records are digitized. And that means that even 5 years, 10 years down the road, we still have all of the records, and with a push of a button, we're able to recreate anything we did 10 years before very easily, very low cost to the patient. and more importantly, knowing the patient will know that you're always there to help them. So in-house manufacturing, digital dentistry, implant dentistry, problem solving, managing all of that in just 1 week of a full arch implant practice. That's it. Jonaathan, Dental Spa, may I help you?